Hello and namaste to all the respected Vaidya, all the respected delegates, all the Ayurvedic students, and all of my friends. My name is Vaidya Abhijit Shinde, and I'm connecting to you from London. I'm practicing in London since 2009, and I'm trying my level best to explore Ayurveda and understand the Ayurveda and helping the community over here with the help of Ayurveda. So today, without taking a long time, I'm going to explain to you, or rather than that, I'm going to share with you my experience with the Panchabautik Chikitsa. So in 2016, I completed the diploma in Ayurvedic Panchabautik Chikitsa from the Sanstha in Sangli. I completed that online because of the distance. I couldn't manage to come there and get it done. But after completing this course, I was introduced to the number of basic principles of the Panchabautik Chikitsa. Initially, my approach was just the theoretical, as usual, as we study into the BMS. But when I started using the Panchabautik, compositions, I was mesmerized and I was so confident to use those on my patients over here, and that's what I'm going to share with you today. So without taking a long time, let's just jump to the two classical cases which I have choose today to share with you, and how this Panchabhutik Chikitsa was helpful to me. I'm still exploring that, I'm still enjoying it, but I would like to share these two classical cases with you. So my first case was a 43 years female, and she came to me. She was the Asian background, she was Indian origin female. She came to me with a very typical and interesting symptom about the floaters in her eyes. So she was complaining like she continuously sees the dots in front of her eyes, and this complaint was with her for the last 20 years. She approached the NHS, which is National Health Services in UK, and she was referred from general practitioner to the consultants, and from the one consultant to the another consultant, but no one was able to pinpoint what exactly was happening with her. Everywhere she was offered the, like, steroidal drops. Everywhere she was offered the promises like it will settle down, but nobody was giving her any good answer for her problem. And 20 years she was lingering around. When she came to us, I started doing the case study, and with that case study, I found the following symptoms and following complaints. So she was complaining about the floaters, black dots in front of her eyes, since last 20 years. She was complaining about the joint pain and stiffness into the multiple joints. And also, the interesting fact she told me is that her visual blurring is associated with the pain episodes in her joints. Uh, because I studied the Panchabhatik Chikitsa, by this time I was able to diagnose the Prakriti as Amla Prakriti and Kshar Prakriti. So I diagnosed her Prakriti as Amla Dharmi Prakriti based on her date of birth, as we all know how to do that. Datar Shastriji blessed us with all this. So I diagnosed her as Amla Dharmi, and while taking the history with her, I found like in her daily consumption, she was eating the pickle, lemon, tomato. She was eating the yogurt a lot. So yogurt a lot. So basically, this is all the amlarus dominant diet she was taking. Also, on top of that, she gave me the history of the chicken pox in her childhood, and she did mention it was a severe chickenpox. Based on that, I started, based on this history, I started immediately, like thinking about the Amla and Kshar Siddhanta. And I will quickly jump onto the medication because because of the lack of time. That I started using the Bruhat Vasakadi Kashay. I started using the Saptamrut Loha. I started using the Apamarga Kshar, on which I'm going to explain quickly. And I started using the Amrut Mustadi Kashay. So because Amla Dharma was increased, I wanted to use the Kshar Dharmi. That's Kshar Dharmi some herb. That's why I used the actually Apamarga Kshar. And Amrut Mustadi Kashai, as we all know, is the Asti Majja Pachak. And we know the eyes are made up of the Majja. So I wanted to work onto the Majja Dhatu. I diagnosed that her Pitta, that means her Pitta Dhara Kala was disturbed because of the Pitta, because of the Amla Dharmi. So, Ya Eva Pitta Dhara Kala, Sa Eva Majja Dhara Kala, we all know that. Based on that, I choose this number of herbs and I administered that. To my surprise, within the 2 weeks' time, her floaters, her dots, they were 60 to 70% better, for which she was struggling for the last 20, almost like 20 years. And I continued the same herbs for the another 3 to 4 months, and she was completely relieved. So that was my first case. I'm sorry, I'm just going a little bit fast because of the lack of time. I will jump on to my second case. The second case was diagnosed as the granuloma annulari. Now, this is the skin condition which was diagnosed by the a dermatologist, in which a patient does show the ring-like skin lesions. She was showing the burning, and she was showing the irritation as well onto the skin. This lady was 70 years old lady, a factory worker, and she came with this ready diagnosis. Of course, I did not work on her diagnosis. So according to the Panchabhautik Chikitsa, again principles, I started taking the case history, and I found this time that her prakriti is a Kshar dharmi prakriti. Again, when I took the history, I found like she was giving me the a history of multiple miscarriages. She was giving me the history of severe chickenpox and the shingles. For the herpes, we call here shingles, and she had that twice. So that was more than sufficient for me to understand and utilize the Amla and Kshar Siddhanta over here. Associated with that, she was giving so many other episodes. For example, multiple episodes of the malaria, hay fever, asthma. She was diabetic, and she was the patient of the angina along with the high blood pressure as well. So based on this information, again, I, in my head quickly came is the Amlakshar Siddhanta. I understood that Ksharadharmi Ushnata is increased, and I need to use something Amladharmi herbs over there. So without without hesitation, I started using the Paripatadikada and the Rajni Yoga. Before that, when I did the Udar Pariksha, when I did the abdominal examination, I found that the Yakrut Sparsha Sattva was there, and there was the Ghananad onto the Yakrut. So I used the Falatrikadi, and I used the Paripatadikada Rajni Yoga along with the Falatrikadi, and I used typically Champakadi Agad, because Champakadi Agad, reason to use that was she was giving me the history of multiple episodes of the malaria. This principle I learned from my guru Vaidya Samir Jamadagni, that whenever we get the history of any bites of any Kitak Dansha, then we should use the Agad. And so many times we find the correlation that the Dansha which was done previously can impact now. And used the Paripatadikada, Rajni Yoga, Champakadhyagad, and Falatrikadi along with the Lagumanjishtadikada. Again, the same thing happened, and that within the 2 weeks' time, all of her rashes, all of her lesions, with the irritation, with the burning, they started slowing down within 2 weeks' time. So 60 to 70% relief she got within that 2 weeks' time. And I want to just summarize this quickly, that these two classical cases gave me the enough confidence to work with many patients. Since then, I'm working with many patients using the Panchabhutik Chikitsa principles. I'm very thankful to Dr. Prashant Suru sir, who gave me the opportunity to share my experiences with you. I'm very thankful to Dr. Arvind Kulkarni as well, who is continuously supporting me to understand and explore the Panchabhutik Chikitsa very well. And none other than I'm very much thankful to our Atmaram Datar Shastriji, because he is the pioneer of this Panchabhutik Chikitsa, and he introduced the world with this Panchabhutik Chikitsa, which is just gives the mesmerizing and unbelievable results. So thank you very much for all of you for listening me and giving me the opportunity to share these experiences. I'm very sorry I may have gone a little bit fast due to the lack of time, but I wanted to share my gratitude. I wanted to pay my sincere thanks to Datar Shastriji and all the everyone who is involved in spreading the Panchabhutik Chikitsa all over the world. Thank you very much, and all the best to everyone. Thank you.